Hello, this is Dr. Sean Carlson from Simple Orthodontics in Larkspur, California, and we have been using Invivo models for almost 20 years now. Invivo models were produced and they started right around 2006, and I cannot tell you how important these models have been for our practice. And a lot of people, when they think of 3D imaging and surface mapping like Invivo models do and like Osteoid does with these CBCTs, when you surface map the teeth and the jaws, a lot of times people think this is, this is important for doctors. And what I've found and the way we've used it in our orthodontic practice for over 20 years is it's a communication tool for patients. And not only can you visualize structures that previously were very difficult to see on a 3D CBCT image in its raw format, but you can move the teeth into simulated treatments. So it's a way to teach patients how your orthodontic treatment is going to play out. Or if you're doing orthognathic surgery, it allows you to describe with visuals how those treatments are going to play out. This is such an important tool when it comes to patient communication, and also when it comes to inter-colleague communication. So like I said, we've been using these digital models for so long now, it just seems like that's just the natural way of talking about 3D images. And we share these with our referring doctors to describe how we're going to do orthodontic treatment. And one place where it's really come in handy and it's incredibly beneficial is when we order specific surgical procedures from our oral and maxillofacial surgeons. And now, of course, using Invivo Workspace from Osteoid, we're able to share those digital images, which are typically big files. We don't have to worry about emailing, sharing flash drives or CD-ROM drives or whatever from the old style that we used to share these big images. Now we just use Invivo Workspace, and our oral surgeon can get that information very quickly, including 3D surface mapping. So it's really powerful in terms of telling them exactly where I need procedures done, which teeth I need to have addressed. So for example, in our plans, we typically will color teeth that are set for extractions. We will color those red so there's no confusion at all for the surgeons when we send that information over. And for impacted canines, for example, what we often do is we simulate the movement of the canine so that the surgeons can actually understand what our traction vector is going to be for those impacted teeth, and they can remove any bone in the area in the direction of that traction. So these models are just invaluable for how orthodontics is done in a modern age, and I can't imagine doing orthodontics without 3D imaging and without surface mapping and without the fourth dimension, that time and that treatment movement. So Invivo models from Osteoid has just revolutionized our practice from the time they were first introduced, and certainly sharing this information on Invivo Workspace has been an absolute game changer for how we communicate with colleagues. So if you're new to this arena, certainly watch some of the videos, talk to some of the doctors that are using this, because I think it will transform your practice and transform the way you communicate with your patients, with their parents, and with your colleagues. I think you'll love it.